Headaches are a very common problem for anybody, whether they're pregnant, not pregnant, male, female. And so it's pretty likely that sometime during the course of your pregnancy, you're going to have a headache. But for women that are headache sufferers, particularly if they have a history of migraines, there tends to be a problem, especially in the second trimester, where those headaches tend to be worse, more frequent, and more severe, and it tends to get some relief in the third trimester. There are also some specialized headaches. For instance, a headache can be a warning sign in a woman that has preeclampsia. But we're not going to deal with that right now. Let's talk about generalized headaches, and particularly those types of headaches that tend to be a problem, especially in the second trimester. So one of the problems with headaches is that some of the usual medications that we use when we're not pregnant to treat headaches aren't safe in pregnancy. So, for instance, ibuprofen, or anything in the category of what we call NSAIDs, so that's like ibuprofen, Advil, Motrin, those are all synonymous. Or other NSAIDs like Aleve are not safe in pregnancy, and particularly not safe in the second half of pregnancy. The problem with these types of medicines are twofold. Number one is they can affect the baby's kidneys, which can decrease the amount of amniotic fluid. The second is, particularly towards the end of pregnancy, these medicines can interrupt the changes that have to happen in the circulatory system of the baby in that transition when it's born. So the circulatory system changes from a fetus to a baby, and the NSAIDs, these types of medicines like ibuprofen, can interrupt that process and become a problem. So that's the reason that we tell you not to use these types of products in pregnancy. Aspirin, another very common headache remedy, is not safe in pregnancy either. And so anything that contains aspirin shouldn't be used. So what does that leave? Pretty much that leaves Tylenol as far as over-the-counter pain medication or headache medication. And so Tylenol products, acetaminophen is the generic for Tylenol, are safe in pregnancy, and you can take the maximum recommended dose whether you're pregnant or not pregnant, and that's no more than 1,000 milligrams every 4 hours, or basically 2 extra strength Tylenols every 4 hours. And that's the maximum you can take for the headache. If that works, that's wonderful, no problem at all. If it doesn't work, you may need something stronger, or you may need to try other things. So there are some non-pharmacologic things, non-pills or medications that can be tried to help relieve headache. Caffeine is the obvious one. Caffeine is a very good headache medicine, and particularly if you're getting headaches in the first trimester, a lot of times it's because of caffeine withdrawal. So caffeine is basically safe in pregnancy in moderation, but some women will give up caffeine completely, and that can trigger headaches. And so if you get a headache in pregnancy and Tylenol is not working, adding a caffeinated beverage, a little coffee or maybe a soda, can help to relieve the headache. Headaches can also happen if you're dehydrated, so drinking more fluids can help. And it can also happen if your blood sugar drops, so eating a little bit can also help with the headache. People that are overtired are more likely to get a headache, so taking a nap or resting, and sometimes just laying in a quiet, dark room can relieve headaches. So those are things that you can do to help relieve headaches. There are other things such as taking a warm bath or a hot shower, and some people find relief that way. If these remedies aren't working, then a prescription medication is in order, and the one that we usually use in pregnancy is something called Fioricet. Fioricet is a combination of medications. It includes caffeine, Tylenol, and a barbiturate that is also added in, and that combination together tends to be very good for relieving headaches, particularly in pregnancy. Very safe in pregnancy, and that's something that you can ask your obstetrician for a prescription for. That can be taken 1 or 2 tablets every 4 hours as needed, and tends to work really well for headaches. In my practice, if a woman has headaches that aren't relieved by Fioricet, I then refer them to their family physician, because I feel like they've now sort of graduated beyond the normal pregnancy headache and really deserve a bigger workup and more expertise than I can offer as an obstetrician. Narcotics can be taken, but I don't tend to prescribe them for headaches. Again, someone that has a headache bad enough to require narcotics, I think deserves a visit with their regular doctor. So in all, headaches are usually very treatable in pregnancy. They're common, especially in the second trimester. And the good news is they tend to get better as the second trimester goes away, and into the third trimester there tends to be relief from the headache.